As part of our efforts at TwistWorks to support local business, we held several community listening sessions about a year ago. And we wanted to hear from the community what was making business work, what was making business hard. And so these are the 4 issues that kind of floated to the top. We feel that childcare is essential for working families. So we know from this that poverty is endemic in our community. And most families, even if they're, making $55,000 a year, that's still hardly enough to live on. They're still struggling. And so we know that childcare is a key component of being able to get families to work and to keep them in stable employment. And it's also an issue for employers. And we know that we have many employers and businesses here who have a hard time retaining employees. And these are some of the issues that they're facing. So this is an issue for all of us. And so that's why we wanted to have this community conversation.
My name is Ryan Perico. I'm the Director of Policy and Advocacy with Childcare Aware of Washington. Childcare Aware of Washington is a nonprofit that has 6 regional programs that serve the entire state. Childcare Aware of Central Washington serves your community. And we have 4 primary functions that we carry out every day, from which we collect a lot of data that I am now going to be sharing with you all. So right now we're dealing with a crisis. And I think it's important to remember that this crisis was in place before the pandemic hit. So prior to the pandemic, childcare providers were making less than parking lot attendants and pet groomers. That results in a lot of turnover. And it's just kind of sad to think that currently in our society, we're paying people more money to take care of our pets and our cars than we are to care for our young children. A huge part of why access to childcare is so difficult is that childcare is so expensive. Families actually in this state pay more for tuition in childcare than they pay for tuition at our state universities. And so if you think about how much families struggle to pay tuition at universities, the problem is actually worse in childcare. And in childcare, we're asking young families who at best are just starting their careers, to pay that tuition out of pocket. They receive very little assistance. And if they don't pay that tuition, then those parents themselves can't work. And that leads to not only problems for that family and for that child, but for the economy overall. So that results in over 500,000 kids who need childcare are not able to access it. And this has long-ranging ramifications. It costs our employers, the economy, and the state billions of dollars. And the Department of Commerce has actually put out a couple of studies recently that put numbers to this. And they concluded that every year, Washington state employers lose $2 billion in direct costs related to not being able to find the people that they need because those potential workers can't find childcare, or because of the turnover they experience within their existing workforce because their employees are unable to access childcare. You can see in front of you our childcare data sheet that we've been updating every day in order to inform people about what's happening because of the pandemic. But I'll just go over a couple key points here. At our peak, 25% of all licensed childcare programs were at one point closed down due to the pandemic. To this day, about 16% of all licensed childcare programs are still closed because of the pandemic. This situation is more difficult on larger centers. And so even though only 16% of our programs are closed, that equates to over 20% of our entire capacity to serve kids and families is currently lost due to the pandemic. The reasons why are financial. Programs are experiencing a 45% reduction in enrollment on average across the state. That's particularly hard for programs that serve school-age children because of that situation that they're in. But when you lose 45% of your enrollment, you lose 45% of your income. And that makes it very difficult to sustain your business. It's even more difficult to sustain your business when all of a sudden the cost of doing business has gone up immensely. And that's what we're also seeing during the pandemic. Programs have experienced significant cost increases due to having reduced the group sizes that they can have. The biggest thing is just funding. We need to prioritize childcare in our state and federal budgets the way we prioritize other sectors that quite frankly are not as important as childcare, because every sector is reliant on the sector of childcare. Currently in our state budget, investments in childcare make up less than 1% of our total state budget. In comparison, over 50% of our state budget is dedicated to K-12 education. I believe 13 to 17% of our budget is dedicated to higher education. If we funded the early learning part of our education continuum the same way we fund the rest of our education continuum, we would not be in this problem right now. In addition, the federal level needs to make this a bigger priority too. In the last stimulus package, they did carve out some money for childcare. They only provided $3 billion. That only equated to a little over $50 million for our state. That is not enough to keep this system from collapsing. You compare that to, say, the airline industry and other sectors that have gotten well over $50 billion in relief. Childcare needs to be prioritized at that level as well. We need to provide more childcare assistance to more essential workers. And we need to provide, direct financial support to childcare businesses, just like other sectors are receiving. They need hazard pay. They need access to healthcare. A very small percentage of childcare workers, because they make poverty wages, actually have access to healthcare. And yet they are putting themselves at risk every day by caring for kids of essential workers, caring for kids of doctors and nurses who are, being exposed to the virus, and providers and these businesses are being asked to take on that risk without any support. And we also are hoping to protect existing investments that we have in childcare. Again, they're not many, but the ones that we do have are critical, and they're even more critical now than normal. I'm talking about supports for homeless families, supports for mental health within childcare programs. I think the point was made earlier about how incredibly important childcare is to employers. We're engaging employers. We're working with the business community to try to rectify this situation. We have a few ideas here that we always tell employers that they can do to help out with the situation. First and foremost, just survey your employees about what their childcare needs are. And we know if they can't access childcare, not only can they not come to work, but they can't be productive when they're at work. We encourage employers to look into childcare flexible spending accounts and other benefits that can directly, impact their employees' ability to not only access care, but stay in it. And more than anything, what I say to this group is, if you are a business leader, if you are an employer, use your influential voice to advocate for childcare. Contact your elected representatives, tell them that you're an employer, tell them that your employees are struggling for childcare, and ask them to prioritize childcare more greatly than they do now.
We are going to hear now from Tanya Gonzalez about her experience running a daycare.
I am a Waldorf teacher and also a Lifeways trained teacher. And so Lifeways is the Waldorf approach to childcare. I ran a couple of in-home daycares. The first one I did as a single mom with my first child. And what moved me to do a home daycare as a single parent was because I just couldn't. I was looking at daycares. I didn't like the institutionalized daycares I saw, and then also the in-home daycares. The quality of care was really poor. You're talking about kids sitting in front of TVs, eating TV dinners type of thing, right? Then also here in the Valley in TwistWorks, my second son, I also ran in-home childcare center. It allowed me to stay with my child, but and I was able to support my family with it while doing it. But there's certain things that did make it challenging, especially if you're looking to set up a home daycare. There's a lot of regulations. There's a lot of WACs, I guess is what you call them, the WACs that you have to fulfill in terms of looking at your space. When I had the daycare in Twisp, it was very successful. It was wonderful. And then, when I looked to, and we had to do some shifts with the space, which wasn't too bad. But then when we moved to a new place, I was looking at wondering, okay, do I take this childcare with me? And I had the licensor come out, and she looked at the space, and then it was like, oh, you're going to have to, basically like bulldoze this and make it flat and put up fencing and all this stuff. And I was like, I can't do it. That's like, thousands of dollars that I would have to put out to put into something that, doesn't make a ton of money in the first place. So that's one of the challenges, is having the right type of home. And then the other drawback was also just the isolation. And so the first year I did it on my own. I had 6 children, and it was lovely. It was fine. But having to, work 5 days a week by yourself with children was very draining. There was no community and no colleagues to lean on. And so then I decided to hire an assistant and take 8 children. But what that ended up doing was a great cost, right? So all I could afford to pay my assistant was minimum wage, which then by the end of the year, when you do the numbers, it's like, well, okay, I only made $15,000 that year. So those are the challenges. But that being said, I think there's definitely, if we can think outside the box, ways that we can encourage people and support them in ways to have, an in-home childcare center, especially if they have children of their own and they don't want to have to pay all that money for childcare. As we just heard Ryan explain how expensive it is. So, you do end up saving money that way if you have your own child at home and provide childcare for others. I would imagine if you were just a parent and you just did the STARS training and you went in and you did all the things, you got your house ready and you started taking children in, but you didn't have the training in terms of like, okay, how do I create rhythm? How do I support the needs of the children? How do I nourish myself so that my well is full and I can keep serving my families in a good way? I think that also really needs to be in place for it to be sustainable and get rid of the high burnout rate.
Next, we'll hear from Danny, and Danny's going to talk about Little Star.
Thank you so much, everyone, again, for being here tonight. We've made some really big strides in our community in terms of improving access and affordability to childcare and early learning through the incredible collaboration of this community, but we have more work to do. We've been here 38 years now, and now we have a campus in Twisp and Winthrop, ages 0 to 3 in Twisp and ages 0 to 6 in Winthrop. And we operate year-round and Monday through Friday, typically 7:30 till 5 p.m. So we've grown quite a bit in response to the community needs, from 36 kids to 130, and we now have 40 teachers and staff members, and some of our teachers have been with us over 25 years, which is incredible. So our response to COVID, mid-March, we closed in partnership with the school district temporarily to protect our community against the spread of the virus. We also suspended billing, our tuition billing for families to free up those much needed resources, which meant we lost 80% of our revenue. We were able to reopen in April for small groups to serve essential service providers through the end of June. We also did receive the PPP funds, so we were able to pay our staff through the end of the school year. We were also able to pay hazard pay for our staff that were here during essential care. We successfully ran our summer programs in July and August, and we made many adjustments. We reduced the sizes. We took a huge hit in terms of our revenue. We moved some groups outside, which was really successful, that we could open up some other classrooms here. And teachers stepped up to provide the care that families needed. And we prioritized those that needed care specifically to work. Over 30% of our families do receive financial aid. And this year we're budgeted to give away over $100,000 in need-based aid. And 10% of our families receive the state subsidies, but the reimbursement rate for Little Star only covers about 50% of our true costs. And then we cover the rest through our financial aid program. Our tuition this year is down about 20% because of the reduced class sizes. How you can help, Ryan mentioned ways to get involved in advocacy at the state level, and certainly you can email me to learn more about what we are doing. We're a part of the Washington Childcare Association as well, and have learned a lot from Ryan and Childcare Aware. And we know that we are in a better position here in the Met-How than some communities, but we also know we have further to go, and it's going to be, we all need to be involved. We need more childcare options. That was something that Tanya spoke about, but if you know of anyone interested in starting an in-home daycare, please connect them with us. There's still a big gap there. And I think there's currently also still a big gap with school-age children that are either attending school just 2 days a week. And the childcare there is just for essential workers. So it's not big enough to be able to support all school-age children that need care.
Yeah, I'm actually, I'm a co-chair of a task force right now that the governor put together to study to make recommendations on a host of issues related to childcare. But one of the top ones that we're working on right now is developing a new mechanism by which the state actually reimburses providers for the full cost of quality care. Childcare is a very bipartisan issue, especially right now. Everyone recognizes how critical childcare is going to be to economic recovery here. And everyone's saying the right things. But there's the difference between saying the right things and walking the walk. And walking the walk is putting your money where your mouth is. And that's what legislators on both sides of the aisle need to do. They need to put in way more than 1%. If they move that number up to just 3 or 5% of the overall budget, we're talking about quintupling the amount of money that we have in the childcare system. We could pay good rates. We could help all families that need assistance. But the only way we're going to change that is if all of us in every community start contacting every legislator and holding them accountable for the role that they play in, and only dedicating 1% of our state budget to the thing that has been proven through an abundance of research to provide a higher return on investment than anything else that we put our taxpayer dollars towards. They all know that. They all say they want to do the right thing, and we have to keep contacting them and holding them accountable until they actually follow through and do the right thing.
You know, I'm listening to this and I'm seeing the cast of characters that is assembled, and we all get it and we're all passionate about it. You know, listening to what Ryan's saying, and I wanted to just share a new dashboard that the Washington State Department of Commerce has published to help us understand the economic recovery of our state. And if you look at this dashboard, nowhere does it talk about the fact that, you know, the support programs that are being offered. Where is childcare? You know, where is anything to do with that piece of our economy and that health? And how can we get that to be something that is recognized and becomes top of mind in a dashboard?
I would really encourage you to collectively engage your employers in the Valley and get, you know, and see if they feel the same way. And if they don't, provide them the education and background that they need in order to understand it better. Connect them with childcare providers so they can see these are small businesses. These are part of Rotaries and part of chambers that, you know, that we should really care more about. And there's been an abundance of media coverage over the last 6 months about the importance of childcare to economic recovery from the COVID. And that's very top of mind for employers. We've been partnering now with the Association of Washington Business more than we ever have in our organization's history. They're very much on top of this issue. And employers just have much more influence over legislators than your normal citizen.
I think we're onto something with really emphasizing this from an economic standpoint and encouraging our businesses to join us in this effort. So that seems like a great goal for our Little Star South collaborative going forward.
Well, I would just say thank you so much, everyone, for being here.
Thank you, everyone.
Thanks a lot.